Hi, my name's Joe Messenger. I'm one of the athletic trainers at Bel Air High School in the Isleta Independent School District. I'm here today to answer questions involving the frequently asked questions with the high school return to learn and return to play protocol involving concussions. There's a return to learn, which we want to make sure the kids can return to the classroom prior to being able to return to athletics, because if they can't function in the classroom, obviously they have no business being on the playing field. So once they complete their return to learn, there's basically 5 steps. Step 1 will be a 15 to 20 minute jog. You can do that on a treadmill, an exercise bike. It's the trainer's discretion. Then after we wait 24 hours, make sure everything's asymptomatic, no problems return. Then we'll go to step 2, which is we're doubling our return to play protocol, which is a 20 to a 30 minute jog. Again, you can do that on a treadmill, the track, a bicycle, wherever that person can get in, 20 to 30 minute cardio. Again, we have our waiting period of 24 hours to make sure they're asymptomatic, and then we'll do step 3, which is a 45-minute cardio and a 45-minute weight training. They can start doing some sport-specific drills. And again, 24 hours, then we're going step 4. Step 4 will be a limited no contact practice. Depending on the sport, if it's football, it's no contact. They can do sport specific drills, conditioning, working out, weight training, whatever a normal practice time may be. And then we'll wait 24 hours, make sure the child is asymptomatic. After step 4, they need to take the papers home and have the parents sign them, consenting that they did receive all the necessary paperwork in regards to MD clearance and the 4 steps before doing their final step, which is a normal practice to make sure that we get them off the concussion books. By law in Texas, a medical doctor or a doctor of osteopathic medicine. The initials for those are MD or DO. Many nurse practitioners and PAs work underneath the direct supervision of these people, so make sure the parents understand, as well as the coaches, that when that note comes back for clearance, it must be MD or DO. If they come back with FNRP, PA, those children are going to have to return to the doctor's office and ask for the doctor's signature and or stamp to confirm who the medical doctor or the doctor of osteopathic medicine is who oversees those people to give them the clearance to return to play. Each high school in YSD currently employs 2 licensed athletic trainers. One of those 2 trainers, in probably conjunction working with each other, will oversee the steps to include the initial assessment to the initial clearance required by the MD or the DO, all the way through the final paperwork in which the parents and that athletic trainer will sign off, scan those paperwork, attach it to rank 1, and get them cleared to return to normal activities. Things that should not be allowed are strenuous activity or sports, no reading, no playing video games, no bright light, no loud noises, and definitely no drinking alcohol. One other thing that parents need to remember is to avoid greasy or heavy meals, as that might cause nausea, which could lead to signs or symptoms of a concussion. The only thing that should be acceptable at that time, the only medication that should be given is Tylenol, as directed by the doctor. They should use ice packs on their head or neck as needed for comfort, to eat a light diet. Sleep is extremely important, as we find head injuries only heal during REM sleep. Return to school unless otherwise specified by the doctor. Limit time with TV, low visual stimulation programming, etc. Limit time listening to iPods, possibly none. And limit time texting or being on the telephone. A lot of doctors will encourage parents to take their phones away, and limit computer use. Again, causing eye strain does not allow the brain to heal.
In conclusion, the Isleta ISD Concussion Return to Play Protocol is in place to protect the cognitive functioning of our student athletes in the classroom and on the field. If you as a coach have any questions regarding the Return to Play protocol, please feel free to ask your high school athletic trainers at your respective campuses. At this time, this concludes the final video of the YISD Concussion Training Series. Please proceed to the Eduphoria Learning Portal to complete your test out. We thank you for your time, and we hope you have a safe and successful athletic season.